Hi, I'm Steve Adubato. Welcome to NJIT. This is One-on-One at NJIT, part of a series we're calling Newark at a Crossroads. We are honored to have Barry Ostrowsky, who is the President and Chief Executive Officer of Barnabas Health, and we're talking big picture healthcare issues. But full disclosure before we do that, Barry serves on the board of public television here in the state of New Jersey.
I do, and I'm proud of that.
Absolutely, and I'm also proud to do leadership development training, and I've also led seminars around some community health matters for Barnabas Health.
And we're thankful that you do.
Let's talk about the fact that there's a very significant merger that has taken place between Barnabas Health and Robert Wood Johnson. Talk about that.
Well, we're delighted to talk about that, Steve. Thank you, and it's an honor for me to be here today. Robert Wood Johnson and Barnabas Health are very similar organizations. Culturally, we're committed to our communities, we're committed to graduate medical education, we're committed to building great clinical programs. And in today's world, you need scale and scope in order to accomplish your aspirational goals of not simply providing health care, but helping our communities stay healthy before they need the conventional clinical care that we've done over the years. So when Steve Jones, their wonderful CEO, and I sat down, of RWJ, sat down to talk about this, we immediately found kinship in our missions, and we found this cultural compatibility. And so we thought, wow, look at the things we could do. We could take our assets, expand our programs, expand our commitment to our communities, and develop the kind of health care that we in New Jersey deserve, and frankly has been evolving over the years.
You know, when I was talking about the community forums that I've been able to moderate with Barry and folks, it's around Newark-centric issues, the greater Newark area. But there are implications beyond that. Talk more specifically, because you talk about scale and scope. Folks might say, hey, that's good for Barnabas, it's good for RWJ, but now let's focus more specifically, because I know you mean, from those conversations we've had, you mean for patients.
Absolutely.
Break it down. A couple of examples.
And by the way, I would expand it beyond patients. I think there's been at least a misnomer about our customer base. Everyone is a consumer or needs to be a consumer. Some become patients. Our obligation is to everyone in the community. We don't have shareholders. Our shareholders are the people who live in our communities. And so our mission has evolved to the point where we evaluate ourselves on how we have enhanced life in our community. And that includes people who are in our institutions and people who we hope never come to our institutions, all of whom typically need to be helped. Now, helping people in that regard, which we consider to be human services, not simply health, helping them in that regard takes an asset base bigger than either of us had individually. It takes a level of coordination and expansion of clinical programs, all of which are available when you have a bigger scale and scope to your organization.
For example?
So if you need specialized social work care, affording that for communities is not easy. But if you can have that spread over multiple communities, you're more capable of affording that. If you have duplicative services, you can make them more efficient, take the very same assets and resources and apply them to these community services. So this is really about saying, look, here are two big organizations. We think both have distinguished themselves in ordinary clinical care and outstanding tertiary and quaternary care. But now let's focus on the everyday life of those who live in our communities. Not everyone needs a kidney transplant, thank God. Not everybody needs cardiac surgery. But most people have daily challenges where folks that we have working with us, our colleagues, could help if we could mobilize them more effectively. That's what this merger will do.
This merger right now, as we speak in the summer, in August of 2015, the Attorney General's office is reviewing it as we speak. If in fact this merger is approved, RWJ Barnabas Health will become the largest healthcare system in the state, one of the largest in the nation. The term population health is used a lot, and you and I have had this conversation offline. And I've had this with other CEOs of hospital systems. It sounds jargony to me. What is it, A? And B, how is the implementation of this thing called population health played out through this merger?
Well, it is jargony. You know, we in healthcare love acronyms and we love all kinds of voguish nomenclature. But the truth is, population health should be descriptive of a new mission for healthcare providers, which detaches the healthcare providers from exclusively delivering conventional clinical care, but now looking into the population, the consumer base, and asking themselves, what can we do to help you? And can we provide social support? Can we provide human services support?
For example, again?
So you have many families, particularly in urban areas, who find it difficult to reconcile their income to the needs of their children and their families. You have multi-generational issues that aren't resolvable simply by some board-certified individual. A social worker, a human service perspective will help a family like that deal with these pressures. I think everybody has a certain level of pressure. Those with more resources find it easier to meet those challenges and pressures. Those without haven't yet gotten an infrastructure where we can help support those social and human needs. That, to me, is population management. On the clinical side, we're able to say to people, look, it's better if you stay healthy. It's, if you show up in our emergency department, obviously it's business for us, but the real goal is allow us to help you stay
How do you
healthy.
keep them out?
Well, you talk to them in an effective way, which candidly I don't think any of us have yet invented, but you talk to folks in an endearing, embracing way about better nutrition, about a better lifestyle when it comes to activity, on the theory that we're going to avert illness. We're not going to keep everybody perfectly healthy, but we are going to avert a certain percentage of the illness and conditions that overtake people. That population health, the combination of managing people's potential clinical needs and offering social support for human concerns, that should be population management.
Is population health or population management, whatever we're going to call it right now, is it harder in Newark, New Jersey?
Very much so. I mean, I think population management, to a certain extent, is challenged by resource level. And if you look at Newark and other urban areas, if you want to immediately enhance healthcare, cure poverty. I don't think, we're not that presumptuous. But we can, in fact, help folks avert illness. We can contribute to the economic development of urban centers. But the challenges in the urban areas are much different than the challenges in other areas. And frankly, every demographic and population cohort is different. Seniors have certain requirements that aren't fully met right now. And those who live in rural areas and those who live in suburban areas have different needs. Population health is supposed to address those needs, presumably setting priorities so we deal with the most important and difficult issues first.
Before I let you out here, Barry, real quick, in the city of Newark and around the city of Newark, Barnabas Health has which healthcare institutions?
Newark Beth Israel Medical Center, Clara Moss Medical Center, and in Essex County we have St. Barnabas Medical Center. And Essex County, which is a spectacular county, I'm born and raised here, we think we can even improve the lifestyles of those who live in not only Newark, but the greater Essex County area.
And there'll be many counties that RWJ Barnabas Health covers. In fact, we are talking about the counties of Hudson, Essex, Union, Middlesex, Mercer, Somerset, Monmouth, and Ocean counties. That will be the footprint, and we'll follow the story as it's with the Attorney General's office now. Barry, thank you for joining us.
Thanks, you,
Barry.
Steve.
Stay
it's
right
always
there.
a pleasure.
Newark at a crossroads at NJIT, a great institution. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this special edition of One-on-One with Steve Adubato at NJIT has been provided by NJIT, Prudential Financial's Global Communications Department, United Airlines, TD Bank, PSE&G, Verizon Communications, and by the Fidelco Group. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato at NJIT has been produced in cooperation with FiOS One News.